Okay. Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM Institute. Today, we are going to discuss about speaking task and the complete sample video of speaking. But before I do that, I would really request you or advise you to subscribe this channel for the best OET sample videos. So today we are going to cover this task. First of all, there are certain instructions I would like to tell you about speaking. Like if I'm speaking right now, you can see my face, you can see my fingers, but in exam, when you are judged or basically when you are given marks, you are like this, you are not there. Basically, you are judged in OET speaking. Examiner gives you marks for your audio, like the way I am speaking right now. That is what carries the marks. And as you are listening to me right now, you can well understand that fluency is the most important thing. If I am speaking this way, when you cannot see me, it's only my voice and the fluency and the loudness. Fluency and the loudness, these are the two important pillars of speaking which tells the examiner how confident you are. Like in writing, grammar is the first thing. Purpose and grammar are the two pillars. Right purpose and right grammar, you will pass. In speaking, right fluency and loudness will get you marks. These are the two major things you have to work out on when you are talking about. If you miss this point of speaking or this point of speaking, you still will pass. But if you are not loud, if you are not fluent, you will not pass. So the major thing, again, I'm telling you, for speaking, fluency and loudness. Because see, that is what you're gonna be judged for, like I'm speaking right now. So you would be understanding, okay, this person is speaking fine, his fluency is good, his loudness is good, his confidence is good, so I should pass him. So that is what examiner gets, only the audio. You don't get any marks for the gestures. Second important thing apart from all these things, interlocutor does not have any marks. Interlocutor means examiner does not have any marks. So whether you ask, oh, examiner said me, sir, I am very brilliant. How could I lose it? How could they fail me? There is no use of asking the examiner. He does not have any marks. Only your audio part will go and that will give you marks. So fluency, loudness, and the third important thing to get 350 or more than 350 in speaking is last reassurance. Reassurance or summarization the task means in the end you reassure the patient that there is nothing to worry, you will be fine. There is nothing to worry, you will be fine. This carries lot of marks when you are ending the role play. And never say thank you so much. Never say that. If you do all the speaking fine and in the end you do not reassure the patient and you say see you soon, he won't let you go. We never say the patient see you soon. We are from medical backgrounds. It doesn't look nice when we are nurses and doctors and we say see you soon. Doesn't make sense. Thank you so much. See you soon should be avoided. Reassurance, very, very important. If the patient is an end stage patient, then you cannot say, I reassure you that you will be fine, because he is an end stage patient. So you should not say, you should say, don't worry, we all are here to help you in the best possible way, and we will try our level best to save you from all this thing, or at least save you from suffering. Means we cannot save you, but we can save your suffering, we can save your pain. So that is what you can say at the end. Let's see what is this role play, because you have told me today to do this role play, so I need to see what it is. So that is what I will get in my role play. I have told you all the important points. Please do not ignore any important point. Again, I will write it. Fluency, please don't ignore it. Even this one speaking can change your life. Loudness, reassurance or summarization. I'm writing that down for you. Never say thank you so much. Never say see you soon. These 3 points are important and we will go according to that. Now talking about other aspects of the OET speaking. If you are listening to first OET speaking video, then this video will do everything for you and you don't have to do any second video even. I will make this video complete for OET speaking. Okay. Now Now I will get the role play. After the warm up question, examiner will give me the role play. I will get the role play. I will get 3 minutes now. So my 3 minutes start now. I will see candidate role play, nurse setting, community health center. So I am a nurse at a community health center. I am speaking with a 35-year-old who has recently been diagnosed with anemia. His hemoglobin is only 8 grams per deciliter. Their doctor or his doctor has referred her to my community center for further advice concerning their condition, his or her condition, and necessary dietary adjustments. So I will say good morning. My name is Bhupesh. I am a nurse over here. That means over here means community center. So good morning. My name is Bhupesh. I am a nurse over here in this community center. So I have got to know about you that you have recently been diagnosed with anemia and your hemoglobin report shows that you are having hemoglobin level of only 8 grams per deciliter. So that's why your doctor has referred you to us for the further advice and to make necessary dietary adjustments. Am I right, Mr. John? So if I'm taking it as patient, I can say Mr. John or Miss Maria. Find out if the patient has any question regarding the diagnosis. So when you get question like this, obviously you do not know what would be the questions, but interlocutor knows. So interlocutor would be given over here that the patient is confused by the diagnosis and how it relates to your diet. So the first question patient will ask you, see, first of all, nurse, I'm really confused. What is anemia and why is it related to my diet? I am a vegetarian. Ready meals. I eat vegetarian ready meals because I believe they are healthy. So that is, we will say, explain that iron is only sourced from the diet, and then you have to explain that. See, first of all, let me explain that anemia is basically due to the low hemoglobin level, and hemoglobin is majorly because of the iron, and the iron is only sourced from the diet. So that is why we are talking about the dietary adjustments, because diet is the only way to maintain your iron, and it can be low in the vegetarian diets without planning. So I want to reassure you that it is a treatable condition and that can be done only with the dietary modification. So that's why dietary modifications are very important. Then I would like to suggest you the ways. First of all, now just see, I would like to suggest you the ways in which you can increase your iron intake. So you should eat more of beans, leafy vegetables. I will give you the examples of leafy vegetables. So you should eat more of spinach, kale, tofu, iron fortified cereals. Are you getting my point, Mr. John? Yes, nurse, I'm getting the points. Okay, that's great. And also, I would like to tell you that it is very important for you to decrease your coffee consumption. So you lengthen the role play by splitting it. So first of all, you are talking about what is needed. Tofu, iron, spinach, kale. Then you say, are you getting my point? Then you say, I would like to tell you that you should reduce the consumption of coffee because it inhibits the absorption of iron. So I hope you are understanding my point, Mr. John. Okay, well, great. You are understanding my point. So that let me take you further. So now I would like to discuss about the importance of food combining as a compromise. Allow 1 hour between consuming iron-rich food and coffee to increase. Okay. So if you are very much fond of coffee and if you cannot stop the coffee, then I would like to tell you about the combinations of the food, that at least have 1 hour break between consuming iron rich foods and coffee. So you should never have iron rich food along with coffee, or maybe within 1 hour. At least give 1 hour break to your coffee if you are taking anything. Second thing, vitamin C at some time as iron rich food. Vitamin C is good for iron or bad for iron? I think it's good. Vitamin C at some time as the same time. So vitamin C increases the absorption of iron, so iron rich food, so it should be taken at the same time. Vitamin C means you should eat more of oranges, fruits and other things. So that is what is the role play, and this you will not get in the exam, but examiner will ask you, tell about questions about daily routine. Examiner, the patient will basically, examiner is patient, so patient and he does not have any marks, so don't worry about his judgment. Just speak loudly and fluently and consider him only patient. Coffee for breakfast, frozen meals for lunch. Okay. Be resistant to nurse suggestion as you dislike tofu and greenualized way. Coffee helps you to cope up with the steps. Finally, agree to the recommendations, but be adamant that you cannot reduce your coffee consumption. So it has been told to the patient that he will not stop coffee because it releases his stress. So in your case, you have this coffee thing. When this point is given that you should take 1 hour break between the coffee, so obviously you automatically understand that it at this point when you will say you should stop coffee, then patient will say I cannot stop coffee because it helps me to cope up with the stress. So now you understand the whole role play, and I will take you one by one. Good morning, Mr. John. My name is Bhupesh. I am a nurse over here at this community health center. So, your doctor has sent me your reports, and according to which you are having anemia. You have recently been diagnosed with anemia, as your hemoglobin level is only 8 grams per deciliter. Am I right, Mr. John? Yes, nurse, you are right. But I do not understand this condition very much, and I would like to know. Don't worry, Mr. John. I would explain you everything in the best possible way. First of all, I would like to tell you that anemia is basically low hemoglobin level. Low hemoglobin means it is a very important chemical in our body which is required for the proper functioning and the formation of blood in our body. So your blood is not having hemoglobin, that means enough hemoglobin, that means you are having anemia. So it is just a condition which is treatable by the dietary modifications. But nurse, I do not understand, like, why is it important to make dietary modification? See, in that case, I would like to tell you that iron is only sourced from the diet. As the main component of hemoglobin is iron, so iron can only be sourced from the diet. So in your case, it is very important to make some modifications in your diet. Are you getting my point, Mr. John? Oh yes, nurse, but I am a vegetarian and I think vegetarian people have the most healthy food. And I think my iron should be fine and I don't want to make modifications. See, I understand, Mr. John. In that case, I would like to ask you about your diet. Could you please tell me your dietary routine? Well, nurse, I take coffee for the breakfast, have frozen meals for the lunch. Then again, I take coffee and cake in the afternoon and rarely eat dinner. So that means I just take breakfast, coffee, and then frozen meals for lunch. Then again, coffee or tea or cake, and I do not eat dinner. See, Mr. John, as I am listening to you and talking about your dietary routine is not really good because you are having lot of coffee. And coffee is a very important thing. In a way, it is not a very good thing when it comes to the absorption of iron. So, coffee basically inhibits the absorption of iron. That is why it can also be one of the reason which is causing this low hemoglobin in your body. Are you following me, Mr. John? Well, nurse, yes, but I really love coffee. That I understand, Mr. John. I'm not saying that you should not have coffee. Yes, but few days you can avoid it. But after few days you can have your coffee. It is not a problem. No, nurse, I cannot leave my coffee even for a single day because it relieves me out of my stress. Now you don't worry about your points. You answer the question of the patient, which is more important. See, again, Mr. John, I totally agree. If you cannot drop the coffee, if you cannot quit the coffee, then I will tell you a method. But now I would like to tell you, or first I would like to tell you about the foods that will help you to increase your iron in your body. So should I explain you about those foods? Yes, nurse, of course. Okay, so I would like to tell you that beans, green leafy vegetables such as spinach, kale, tofu, and iron fortified cereals. Sorry, just as you know, I'm struggling with this. Okay, I will try. So these are very important to increase the iron intake. So you need to increase your spinach, kale, tofu. But I hate these kind of foods. I totally understand, Mr. John. But for the time being, these foods are very important for you. And also, I would like to tell you that combination of foods are also very important. That if you want to take the coffee, then you should have at least 1 hour gap between the iron rich food and the coffee. As I have already told you that coffee decreases the absorption of iron in the body, so it is very important to have 1 hour gap. Have you understood, Mr. John? Should I repeat anything for you? Oh, well, nurse, I have understood. So basically, I need to take a break of 1 hour between the food and the coffee. Absolutely right, Mr. John. I'm glad that you are understanding and you have understood my point. Also, I would like to tell you that you should increase the intake of vitamin C. That means fruits like oranges, grapes, they have lot of vitamin C, and also they increase your immunity as well. But more importantly, in your case, they increase the absorption of iron and increases the level of hemoglobin in the blood. So I hope, Mr. John, you have understood all these points. Yes, nurse, I have understood all these. That's great, Mr. John. And I reassure you, anemia is a condition that can be treated without medications if you will have the right dietary modifications. So I hope you have understood all these dietary intakes. Here is the leaflet. It contains all the iron-rich foods, and also it has all the important point of our conversations, which you may read at your home. And if you have any doubt, there is a number in the leaflet. You can contact me on that number and I will provide you the necessary information. Is it all good, Mr. John? Okay, then, Mr. John, now you take care of yourself. And I really wish that you recover from this condition as quickly and you would be able to make dietary modifications. Okay, then, take care. Bye bye. That's it. That is how you do the role play. And please now don't stop this recording. Listen to this recording 2 3 times. I know it's boring to do the same, but if you will practice this speaking right now 3 times, I promise you, whatever speaking would be there tomorrow with your teachers or mentors, you will have better go at it. You will be able to speak better. But for that, you have to listen to this speaking 3 times and speak it in front of mirror. Speak the same speaking again. Means at least practice the same speaking in a day 3 times. That is what will, if you will keep on changing the speaking, you will never improve. Again, I am telling you, today we are covering two important modules, speaking and listening. These two modules require at least 3 times repetition. The problem with that, we do one listening, then we start doing another listening, then we start doing another listening. That is the same problem with the speaking. We do one speaking, then we do another. Otherwise, that is the same problem with reading and writing too. But you really need to understand that it is very, very important to repeat the same speaking, same listening, same reading, same writing to improve your grammar, to improve your fluency, to improve your loudness. Because when you change the speaking, your conscious mind gets engaged in the next task. So you think about data. But when you do the same speaking, then data is same. You think about loudness, you think about fluency. That is what improves you. When you do the same speaking again, you focus on other aspects like fluency and loudness. Sorry, I'm stopping it here. Thank you.